Recording in progress.
Thank you all for joining us today. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today, and we are limited to 1 hour. If there are remaining questions in the queue when we conclude and you feel your question hasn't already been answered, please send them in the chat or by email, and we will work to get you a response in writing. In addition, Dr. Seaman will only be joining us for the first 20 minutes today and will not be available for media question and answer. Thanks again for joining us. We'll begin in just a few moments after we grant recording permissions. I believe all permissions for recording have been granted. So if you had requested that in the chat, you should now be able to record. Dr. Vanderhoff, it is 11:02, so I believe I can hand it over to you to begin.
Well, thank you very much, Alicia. Good morning. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. The Delta surge continues to drive very high COVID-19 cases, especially across northern Ohio, and very high rates of hospitalization. Yesterday, we reported 8,707 cases of COVID in just the previous 24 hours. Also, as of yesterday, there were 4,297 patients in the hospital with COVID-19, a high we last experienced in January of this year. And that was during last winter's surge. 1,100 of those patients were in the ICU, higher than we had during the height of our recent fall surge, and consistent with numbers we experienced 1 year ago, last December, just as COVID-19 cases were becoming available, vaccines were becoming available to the very first Ohioans. Now, the current surge in COVID-19 hospitalizations is simply putting a dangerous strain on the state's healthcare infrastructure. We are, yet again, in a serious situation, every bit as serious as last December and January. Hospitals are being severely strained, not only because of the high numbers of COVID-19 hospitalizations, but also as a result of staffing challenges, particularly among the dedicated healthcare workers who have been fighting this virus on the front lines for months and months on end. When our hospitals are stressed to this degree, it strains their resources to care for other patients needing regular or emergency care. So it's not just about our hospital's ability to care for a COVID patient, it's also about their ability to care for other important conditions like heart attacks or car accidents. As a result of the incredible volumes hitting our hospitals every day, our hospitals are having to make very difficult decisions and implement contingencies to cope with the volume and to deliver care to those most in need. Now, many have diverted to not only accepting the patients who may have previously been referred to them, but accepting, for example, only traumas that meet certain criteria, or have had to reschedule many surgeries or other procedures. They've diverted patients to other hospitals far from where people live, and they've even had to limit patient visitation. Now, what's driving all of these Delta hospitalizations in Ohio? Well, when we look at the data, our COVID-19 hospitalizations continue to be driven largely by unvaccinated Ohioans. Severe illness with COVID-19 is, as we know, largely preventable thanks to our vaccines. The facts continue to provide us a clear reminder that when Ohioans choose to be vaccinated, they're better protecting themselves from severe illness, including hospitalization and death, and they help mitigate pressure on our hospitals so that timely care is available when any of us need it. When someone chooses to be vaccinated, they're helping to ensure all Ohioans get the medical care they need when they need it. The rate of hospitalization is very high in communities all across our state, reflecting our very high case rates. But the problem is especially acute in the north. An analysis of hospitalizations over the last 2 weeks shows that on average, about 62% of all newly reported hospitalizations occurred in the northern part of our state. Now, not surprisingly, recent data also shows that as a whole, hospitalization and death rates are higher in counties that fall below the state vaccination average. So it's clear that higher vaccination rates are associated with lower rates of hospitalization and death. And conversely, lower vaccination rates are associated with higher hospitalizations and deaths, because that's what vaccines were created to do, to keep people alive and out of the hospital. Now, we looked at this data specifically from April 1st through November 28th, after vaccines were available for everyone age 18 and older in Ohio. And our findings show that COVID-19 vaccines have consistently worked as designed, which is to protect us from severe illness, the kind that results in hospitalization or death. While you might, as a vaccinated person, still get a mild case, the COVID-19 vaccines do a very good job of protecting you from serious illness. Generally, we found that hospitalization rates are 35 to 40% higher in counties that fall below the statewide vaccination rate average, compared to counties that are above that statewide average. Furthermore, death rates are up to 94% higher in counties below the statewide vaccination average. In short, all the evidence reinforces that COVID-19 vaccines are our surest protection from severe COVID illness, including hospitalization and death. Now, joining me today from the northwest corner of the state, where we're seeing extremely high hospitalizations as well as COVID-19 cases, is Dr. Gary Seaman, whose role primarily is that of a family physician at Parkview Health, and who also serves as medical director for the Williams County Health District. Dr. Seaman, we've heard that hospitals are inundated, and you're working in the urgent care one day a week, and are actually there, I believe, right now, where you're certainly on the front line of seeing the large increase in patients. Can you explain more about what you're seeing and how you're encouraging the patients that you see and people in your community to protect themselves?
Sure. Well, first, Dr. Vanderhoff, thank you for having me today. You hit the nail on the head. Vaccination is our best protection. And sitting here in Williams County for the last 3 weeks running, we've seen a huge surge in COVID cases, just 230 cases in the last 1 week of patients having COVID, 7 new hospitalizations and 2 deaths. At any given time, we're averaging probably 10 to 15 patients in the hospital with COVID. High 90% of those are unvaccinated individuals. The deaths are certainly related in individuals who are unvaccinated. You're right. Our hospital is inundated. Just last week, there was an issue where across our region where we have mostly rural hospitals, our closest city is Toledo, but 3 of the other rural hospitals in the area were on EMS standby, which means that their hospitals were so overwhelmed that they couldn't even accept an ambulance with a sick patient. So that patient from 45 minutes away needed to be diverted to another hospital. It wasn't a 10-minute ambulance trip for a sick individual. It was potentially 30 to 45 minutes to get the care they needed. That's a delay in care. That's a delay in urgent care. And when we do have patients in our hospital that need to be transferred for specialty care, say an infectious disease specialist or a pulmonologist that we may not have in these rural areas, the hospitals that provide that specialty care in our larger cities are inundated. They can't accept that transfer. So we have stroke patients sitting in our hospital hoping for the best when they really need to be seeing an interventional neurologist in a larger city who can't care for that patient. The COVID pandemic has certainly added to that situation. If our hospitals are full with COVID patients, we can't take the patients who need other care. And you mentioned the outpatient piece. Yes, we're seeing that on an outpatient basis as well. In my general practice and family practice, I've been spending 18 years caring for patients with chronic disease, diabetes, COPD, heart problems, hypertension. And part of what we do is prevention. Okay, nowadays, bulk of our patients coming in the door are respiratory, and it's not all COVID, it's respiratory season. There's influenza, numerous amounts of other respiratory viruses, but the majority of what we're seeing here in Williams County and in the northwest corner of the state is COVID right now. When those people are coming into the office sick, that's taking away patient availability when they have to come in for their chronic disease management. We as family doctors can't see the patients that need to be seen for their chronic illness. In the urgent care, it's even worse. Our urgent care clinic here in Bryan is seeing on average of 60 to 100 patients per day. And I would say the vast majority of that is respiratory ailments. Sure, we see our broken bones and sprains. And honestly, I feel liberated when I get to see that sprained ankle. It's becoming very monotonous. And you had mentioned, and I am seeing the majority of the patients coming into the office is unvaccinated individuals, and they're sick. And it's unfortunate that COVID is a disease that there is no treatment for. We have to rely on the body's immune system to be able to recover from this virus, and it takes some people 1 to 3 weeks. That's time that patients are missing work, they're not feeling well. And as a physician, I want my patients to recover. I want my patients to feel well. But as a family physician, prevention is key. And I'll look people in the eye in the office and I'll tell them, this is a preventable illness. You would likely not be sitting here today had you chosen to be vaccinated. And you are right. We're seeing patients, all doctors are, we're seeing patients who have been vaccinated and they come into the office not feeling well. Okay, I explain the situation. I tell them about COVID, the things that are good to recover at home. And I'll look that person straight in the eye and tell them, Imagine how you feel now. Imagine feeling 5 to 10 times worse. You did yourself justice by getting vaccinated. It's very unlikely that this is going to get worse and you're going to end up in the hospital or on a ventilator or dying because you made the right choice in getting vaccinated. That's the message that we need to get out to people.
Thank you, Dr. Seaman. Very, very well said. Really appreciate that. Well, you know, with cases continuing to rise, the best thing, as Dr. Seaman said, that Ohioans can do is choose to be vaccinated. And we've shown that vaccination protects not only each individual from hospitalization and death, but it also helps alleviate pressure on our healthcare delivery system, especially our hospitals. In addition to being vaccinated, the keys to staying safe in the face of COVID remain some of the common sense steps that we have talked about for a long time. Masking, keeping our physical distance wherever possible, hand hygiene, good ventilation, staying home if you're sick, testing when needed, and avoiding avoidable crowds. And as we think about the upcoming holiday season, let's remember that it takes time for vaccines to be effective. If you're getting the single dose Johnson & Johnson vaccine or a booster, it takes about 2 weeks after your shot to reach that maximum level of protection. For a 2-dose series, it takes 5 to 6 weeks from that first shot for maximum protection, depending on the timing and the vaccine you received. Now, as we think specifically about the upcoming holidays and potential gatherings, let's remember that Christmas is just 2 weeks away from this Saturday. And the best gift that you can give your family is to protect them from getting really sick or worse. So in addition to getting vaccinated against COVID and flu, if you're planning to gather in the coming weeks, you might also consider getting tested before going to that holiday gathering. Well, next I'm joined by Dr. Teresa Zirid, who's president of the Ohio Academy of Family Physicians and who works in the Premier Health System as a family physician. Dr. Zirid, as a family physician, you of course treat patients of all ages when they are sick and otherwise, and you're, I'm sure, working to help keep them up to date on their immunizations. Tell us a little bit about why it's important to protect the whole family, parents, grandparents, children, with regular immunizations, including flu shots and the COVID-19 shots.
Thank you, Dr. Vanderhoff, for having me, and a great question. As you know, in the United States, vaccines have greatly reduced or eliminated many infectious diseases that were once very deadly. And that's vaccines across the board. So I tell my patients that they can help protect themselves and their loved ones from diseases with vaccines by being able to lower their risk of getting certain diseases, examples being flu, influenza, hepatitis B, HPV, all those routine vaccines that we manage. And then it can also lower their chance of spreading diseases. And one of the big vaccines there that we really became aware of a while back were infants who could get pertussis or whooping cough. And we didn't realize that adults were the ones that were carrying that disease, and managing it was what we needed to do to take care of our infants who couldn't be vaccinated at that point. So we've come a long way in trying to manage all of this, but it is a twofold, making sure we're taking care of the individual and then taking care of the community as well.
Thanks. You know, with so much going on right now, Dr. Seaman referenced that, we're in that respiratory virus season. We've got colds, we've got flu, RSV, and COVID-19. What are some of your thoughts and what are you recommending to your patients as it relates to testing in this season of the year?
Well, certainly we're looking at influenza, RSV, and COVID as being kind of our big three respiratory issues right now. We noticed that with influenza or with the flu, you feel bad almost immediately, as you're looking at those symptoms. And then you, after that runs that 4 to 5 day period, you start getting better. With COVID, it's a little bit different. It kind of rumbles along a little bit, and you don't start feeling horrible immediately. You feel bad several days later. So they do carry some of the same symptoms if you look at cough, fever. But with COVID, we're still seeing that loss of sense of smell and taste as being a big indicator. I tell folks, let's see what's happening, but watch those symptoms, and we can always test. And that point of care testing is becoming so important to be able to identify what we really have going on so that we can start treatment as it is appropriate.
Well, thank you so much, Dr. Zierid. As we've discussed and referenced at length already today, it's incredibly important to get vaccinated to protect yourself from COVID-19. In addition, this is National Influenza Vaccination Week, and I want to stress the importance of getting a flu shot for yourself and other members of your family. Flu remains a significant public health concern, and the CDC recommends a flu shot for everyone older than 6 months of age. If you haven't already, please schedule your flu shot today. You can even get it at the same appointment as you get your COVID-19 vaccine. Finally, as you know, we continue to run genomic sequencing in an effort to help identify variants that are active in Ohio. Genomic sequencing is performed on a positive PCR test sample when there's enough of the original sample and there's a high enough viral load in that sample to actually do the further genomic sequencing. On the other hand, most of our rapid home-based antigen tests actually can't be sequenced. Now, at this time, the Omicron variant has not yet been detected in Ohio, but it's only a matter of when, not if, that variant is detected here in the state. Now, while there is still plenty to learn about Omicron over the coming days and weeks, we are closely monitoring new data and emerging research as it becomes available. Now, because the early reports from South Africa have pointed to Omicron being potentially more contagious and more likely to reinfect people, there's naturally been concern regarding whether vaccines would continue to protect us. The results of the early research regarding the vaccines are, however, encouraging, reinforcing the benefits of both the primary vaccination series and, when it is time, boosters. First, research out of both South Africa and Sweden have, in the past days, pointed toward relatively modest reductions in antibody responses to the Omicron variant. Reductions described as one of the lead researchers in South Africa, Dr. Alex Segal, as better than expected. And that suggests that while a vaccinated person may have more risk of some mild infection related to Omicron, there should still be considerable protection against serious illness. Secondly, recent lab tests conducted by Pfizer and BioNTech suggest that 3 doses of their vaccine offer significant protection against Omicron. How do we know this? Well, first, blood samples obtained from people 1 month after they had received a booster shot showed neutralizing antibodies against the Omicron variant that were comparable to the levels of antibodies that were seen against previous versions of the virus after 2 doses. In addition, the tests suggested that the mutations in Omicron don't significantly affect T cells. Remember that cellular immunity is the other critical part of our immune system's response. This apparent preservation of cellular immunity suggests that vaccinated individuals may still be protected against severe forms of the disease after only 2 doses of the mRNA vaccines. So while we still have a lot to learn about Omicron, this variant's arrival continues to underscore the importance of our best prevention tool, and that is choosing to be vaccinated. At this time, we have no indication that our vaccines won't continue to provide substantial protection against Omicron, especially against severe disease, which, as we know, includes hospitalization and death. COVID-19 vaccines, coupled with preventive measures, provide the best protection, including against the Delta variant, which is the dominant strain in Ohio right now. It's Delta that is driving our cases and our hospitalizations right now. So if you have not yet been vaccinated or you're eligible for your booster dose, now is the time to go and get your shot. Finally, I'm joined by Dr. Joe Gestaldo, Medical Director of Infectious Diseases at Ohio Health. Dr. Gestaldo, we've heard a lot about the Omicron variant of late. Can you share with us a bit about typical virus behavior and mutation and what we know about Omicron right now?
Thank you for the question, Dr. Vanderhoff, and thanks for having me again. So basically, Omicron variant represents the next evolution of this specific type of virus. Coronavirus is an RNA virus. RNA viruses mutate. It's what they do. They are prone to replication errors. Another common RNA virus that we're all familiar with, we've been talking about the last half hour, is influenza. Influenza changes to different strains every year. That's why we get a tweaked flu shot every year. And I am certain that we will eventually have a pi variant sometime. Pi is the next letter in the Greek alphabet. When it comes to the identification of variants, we need to do genomic sequencing, as you referenced, and we need to respect the variants and study the variants. I will say this, there have been some variants that have been identified, like the Lambda and Mu variant, which really did not result too much in our country. When there is a new variant described like Omicron, we need to really do a lot of studies to really understand what's going on. And it's more than just lab studies, it's real world studies. And as you mentioned a few moments ago, Dr. Vanderhoff, we are learning more really on a daily basis on how Omicron performs. However, we still need to wait for further real world data. Some of the questions I want to know about Omicron is, number one, is it more contagious? Based on information we have so far, it's looking like that is the case. There's more Omicron being seen in the United Kingdom and South Africa. Number two, do people who have infection with Omicron, are they sicker? We don't know that with certainty yet, but based on information superficially that we're getting from South Africa and parts in Europe, that is indeed the case. And number three, do our vaccines still work? And as you mentioned moments ago, it does appear that our vaccines still provide a wonderful layer of protection against severe disease, even more so with a booster. So Omicron is here probably in Ohio. We have not yet identified it yet, but when we do first identify it, it's nothing really to be alarmed about. We have the tools we need already today. And in the setting of what we've been doing now for almost 2 years, nothing changes in how we really defeat Omicron and any potential future variants.
Thank you so much, Dr. Gestaldo. You know, Ohio has been tracking also what we've referred to as breakthrough infections, defined as those that result in hospitalization and death. And this is consistent with the definition that the CDC uses for breakthroughs. Right now, about 95% of all of our COVID-19 hospitalizations and deaths are still among the unvaccinated. Can you explain to us how vaccines like those for flu and COVID are actually designed to protect you? Can someone who's fully vaccinated and for whom the vaccines actually work still end up with COVID-19? And if so, how does that work?
Yeah, thank you for that question, Dr. Vanderhoff. And, you know, as we have been having vaccines now for a year, some really common themes with the flu shot also exist. You know, the flu shot, like the COVID-19 vaccine. If you get the flu shot and the COVID-19 vaccine, you could still get infection, although you're less likely compared to someone unvaccinated. But what's most important for the immunity you get from a vaccine is exactly what Dr. Seaman referenced. Getting vaccinated gives you a wonderful layer of protection against severe disease. More or less what we call a breakthrough infection as defined by the CDC. A word that I'm using more is a post-vaccination infection. If somebody who is vaccinated gets a post-vaccination infection and they are home with a mild cold or mild flu season, that is the vaccine working. And Dr. Vanderhoff, I can tell you, I have seen many patients in that particular scenario and also talked to many healthcare providers where that was exactly the case. People who have been fully vaccinated and they have a breakthrough post-vaccination infection with mild symptoms. That's the vaccine working. And I feel confident in saying every time I see those cases, especially those in patients who have had risk factors, it's the vaccine working that's keeping them from severe disease, resulting in hospitalizations or death.
Thank you so much. Well, we need to remember that the COVID-19 vaccines, as well as other proven preventative measures like wearing masks indoors, maintaining our distance from others, washing our hands, improving ventilation, staying home, all these work together to help protect us and prevent the spread of COVID-19. If you're sick with symptoms of COVID, you should immediately get a test. Even if you're vaccinated, it's important to follow preventive measures to protect yourself and others. Now, if you test positive for COVID, how you and public health officials react isn't determined by the variant you have. So regardless of which variant may be spreading, and it's Delta right now, isolation and quarantine remain key to preventing further spread of the virus. This is, really hearkening back to what we were taught as children. When we're sick, we need to avoid being around other people so we don't spread what we've got. The importance of a positive COVID test is that it gives you knowledge that okay, I've got COVID. I need to isolate myself for a certain period of time. I need to approach my illness in a certain way. What's not important about that is which variant you have. We'll follow that epidemiologically. We'll keep our eye on what this virus is doing, but it doesn't change your treatment. It doesn't change what you need to do. Now, let's remember our hospitals are facing as great a challenge as ever, with numbers that they are facing that are equivalent to what they faced last January. And that's compounded by the fact that there are fewer health professionals in the workforce now than there were then. Sadly, these hospital cases continue to be driven largely by unvaccinated Ohioans. And remember, as we've said over and over, vaccination is your best protection. And when more Ohioans choose to be vaccinated, they're not only better protecting themselves from severe illness and hospitalization, death, they're relieving pressure on the healthcare systems that support their community. The bottom line is there is no time like the present to get vaccinated. Now, Alicia, I think we can move to taking questions.
Thank you, Dr. Vanderhoff. Our first question today is from Dan DeRose with WOIL.
Good afternoon to all the doctors who took the time today. We certainly appreciate it. I want to go back to some of the statements made by Dr. Seaman, and maybe this applies to some of the other doctors on the call. When he said he looks patients in the eye and says you need to get vaccinated, I'm assuming there's some patients who tell him I'm not doing it. Does that frustrate you as a doctor? You're the expert. You're the one who you're seeing patients get sick. What is the response when you look them in the eye and say you need to get vaccinated?
Well, thanks, Dan, for that very, very good question. I'll kick it off and then turn to my colleagues. One thing I think that we as doctors are very accustomed to is educating, of providing our patients with the best information we can. And sometimes yes, it does happen that we make our best medical recommendation to a patient and they might choose not to follow that recommendation. Obviously, as a healthcare professional, that does carry a certain level of frustration. But I think that our approach typically is to stick with that patient and keep reminding them the next time we see them and the next time that this really is what we think is best for them. And that's a part of being a doctor. Let me turn to my colleagues because I'm sure they both can speak from vast experience to this question. Dr. Zirid, would you start?
Certainly, thank you. Yes, it's a great question, and it is somewhat frustrating sometimes when your patients won't take your advice necessarily, but I keep working on them. Just like Dr. Vanderhoff said, you keep telling them every time they come in for a visit, you ask again, wouldn't you consider getting this? Because I think it's the best thing for you, for your family, and for everyone around you. Eventually, I've been lucky, I've worn a lot of them down. so that's been good.
Dr. Gestaldo?
Yeah, that's a great question. And I can tell you too, when we talk to patients who have not yet been vaccinated, these types of encounters take time. They are really a time investment for every provider having these conversations. And we want to obviously respectfully engage patients, or for that matter, anybody who has not yet been vaccinated. But we really want to understand where they're coming from, understand their fears, their concerns, their feelings of anxiety, understanding that they may be following misinformation that's out there. And we just have to take time and don't give up on people. In my personal family, I have loved ones who have not yet been vaccinated. And like Dr. Zirid said, I'm not giving up on them. And I'm still respectfully engaging those people to get vaccinated. And a lot of it really has to do with allowing patients to have access to reliable source of information and essentially continue to work with them.
Thank you, Dr. Gestaldo. Our next question today is from Joe Ingalls with Ohio Public Radio and Television.
Thank you, doctors, for doing this call. My question is the messaging. It's been a problem, especially when it comes to vaccines. When the vaccines are released, we hear, well, this group should get them, but not so much this group. And then all of a sudden, yeah, everyone can have them. There seems to be some mixed messaging going on. And a lot of people who haven't gotten boosters are saying they're not getting them because doctors at one point said they don't need them because they didn't happen to be in a specific group. Are we maybe at the point where the FDA, the CDC should look at just saying, hey, you folks who are vaccinated, every 6 months, go get a booster? Everyone, not just a specific group, because the messaging is causing a problem, or at least it appears like that from where I sit. What are you seeing as medical professionals?
Well, thanks for that question, Joe. I think it's absolutely the case that clarity of messaging is very, very important. And I believe that along the journey here, everyone has been working diligently to be as clear, as straightforward, as honest as they can about what's known and not known. The real challenge that I think that we have faced is that COVID-19 has been an entirely novel virus. It's something that we had not seen before. And the advent of our vaccines, while a wonderful development, also was something that we had to learn about with time and experience. Yes, so many of the other illnesses that we treat and protect people for with vaccines have been around for eons. They've been around for a very long time. They're very well characterized. And we've had a lot of time to develop the vaccines that are provided. And so the knowledge base has been much greater. We've had, as we've introduced vaccines in this country, and we've shared this as we've gone along, we've had to learn about how people are responding, how the virus is responding, and the virus itself has not been standing still. Let's face it, the Delta variant that we're looking at now wasn't even on the scene when the vaccines were released. And in fact, multiple other variants have appeared between that time and where we stand now. So I do understand that it can be frustrating that our guidance has evolved. But the reality is the evolution of our guidance has been appropriate in the face of a changing pandemic. Now, let me turn to Dr. Gestaldo because of his specialty in infectious diseases. I think this is particularly close to his work. Dr. Gestaldo, what more would you add to that?
Yeah, thank you, Dr. Vanderhoff. And that's a great question. You know, when it comes to vaccines and immunity and immunology, in the setting of COVID, which is, by the way, a brand new disease, a brand new virus that we're still learning from, we are essentially building the plane as we fly it. I have the utmost confidence in the way that the FDA and the CDC conducts their reviews and makes their vaccine recommendations. When you look at the subcommittees within the FDA and the CDC, they are our country's top experts in infectious diseases, vaccines, and various other specialties. And decisions are made based on data. Some of the data is real world data. Some of the data is test tube or laboratory data. But as new information comes in from both of those arenas, the recommendations are very much subject to change. I do agree with being completely open and transparent with the public. But again, historically, we have never been in a situation like this. And we really have to trust the process we have with the review of the vaccines, the level of the FDA and the CDC vaccine recommendations. The way our country reviews vaccines and makes the recommendations are the gold standard of the world. No other country does it in such a transparent way as far as how the decisions are made. And I have the utmost confidence in that process.
Thank you. Our next question comes from Titus Wu with the Columbus Dispatch.
Hi, doctor. Thanks for doing this. My question is kind of, so there's been, national news reports about Ohio being, one of 6 states accounting for, more than half of the country's, recent hospitalization surge. The other states being, nearby Pennsylvania, Michigan, Indiana, New York, Illinois. I'm just curious as to, I guess why you think, Ohio, as opposed to the majority of other states, why we're seeing the biggest hospitalization surges in the country in Ohio.
Well, thanks. That's, of course, not only a very good question, but it's the very kind of question that public health leadership across the region looks at very carefully. A couple of things that we have to bear in mind. Certainly, climate and weather, we know with this virus plays a role. And that region that sort of surrounds the Great Lakes of our country has been experiencing over the last period of the last couple of weeks, a shift towards some very, very cold and more inclement weather that drives people inside. And of course, once we have people inside as opposed to outside, as we've talked about throughout this pandemic, the risks of sharing or transferring any respiratory virus becomes that much greater. And that's true for COVID-19. So I think that's a piece of it. Another piece of it, though, and we see this, and I commented on it in my opening comments, a piece of it, though, clearly is a correlation between geographies that are poorly vaccinated versus geographies that are better vaccinated. And right here in Ohio, we can see that there's a tendency for parts of Ohio that are less well vaccinated to have higher rates of COVID-19 and higher hospitalizations compared with parts of Ohio that have better vaccination rates where the disease is less active. And of course, you're affected by the neighborhood you're in. And even when you look at the state of Ohio, and if you look at some of the maps, there are lots of them that are posted out there. You can look, the New York Times often will post a map. These maps show pretty clearly this gradient of more activity in the northernmost parts of our state than we see in the southernmost parts of our state. And then the communities that spread out across the northern tier of the United States, from Minnesota all the way over to Vermont and New Hampshire, including upstate New York, where you're seeing very high levels of the disease. Again, Dr. Gestaldo, infectious disease doctor, I don't know from your specialty perspective if there's anything you'd add to that.
Yeah, Dr. Vanderhoff, I think you hit them all excellently in your discussion. Like you said before, what we are having right now in Ohio is part 2 of the Delta surge. I'll call it the winter surge. And this is still a very contagious, transmissible virus. It's looking for people who don't have immunity. It's looking for people to infect. And if you look at the heat map of where all the COVID cases are in Ohio and even other northern states, we are seeing more COVID in areas that are under-vaccinated. So that's one part of it. Another part of it, like you said before, Dr. Vanderhoff, it's a change of the season. It's colder out. People are indoors more. We all have COVID fatigue. We have holiday gatherings. We have people traveling. We have many, many factors that are contributing to what I call our winter surge. There are things on the horizon that we could deal with when they pop up, like Omicron, but still, today, what's different today than last year, we have the tools available to offer a wonderful layer of protection to everybody, and that is a vaccine. And that wonderful layer of protection is protection from severe disease resulting in hospitalizations and death.
Thank you, Dr. Gestaldo. Our next question today is from Danny Eldridge with Hannah News.
Hello, Dr. Vanderhoff. So my question is about the hospitalizations, and can you just put it in context? Like, how severe is the situation? When might we start to need to see restrictions come back if hospitals, continue to fill up? And what other strategies besides obviously what you're doing now with just encouraging people to get vaccines? What other strategies can the state employ to get our rate up to what some other states are at?
Yeah, thank you. Very important question. And as I referenced in my opening comments, the situation now in terms of hospitalizations in our state, especially in the northern portions of our state, is as severe as it has ever been. We're looking at hospitalization numbers that parallel those that we saw at the height of last winter's surge. These are very, very substantial levels of hospitalization, and hospitals are already across our state having to take extraordinary measures to be able to respond. And I outlined a number of those, but they include things like putting off procedures and surgeries. They include things like having to transfer people significant distances in order to receive care. And even hospitals have had to limit visitation because of the impact that those extra people have on the ability to manage the large volumes of people that the hospitals are having to take care of. What can we do? Well, it's the message that we have been repeating now for a very long time, and are underlining here today. Vaccination is really the key. We all need to either get vaccinated or get our boosters. In addition, wearing masks and avoiding contact. Let me open it up to my colleagues and see if they would add.
Yeah, well, one thing too, we don't want to forget the other tool that we have. We have one outpatient tool now, and hopefully soon, 2 other outpatient tools. And just to reiterate what Dr. Vanderhoff said, the most important protection you have is a vaccine. Monoclonal antibodies are available. We give monoclonal antibodies to at-risk people who have symptomatic COVID-19 in an effort to keep them out of a hospital. At Ohio Health, that has served us well. We have had great success in giving monoclonal antibodies in an effort to keep people out of the hospital. Hopefully, sometime in the very near future, we will have access to 2 oral antiviral agents, one by the name of molnupiravir, the other one is called Paxlovid. And molnupiravir right now is going through the FDA review process, and Paxlovid will hopefully be following in the near future. These antiviral agents look promising as potential tools to keep at-risk people out of the hospital. But when these medications come out, initially, their supply is going to be limited, and hopefully we'll get more as time goes on. So that's what we have right now for our tools, and we need to think about using them in the appropriate patient.
Thank you very much. Our next question is from Haley Nelson with ABC6 and Fox 28 Columbus.
Thank you for taking the time to do this. I'm curious, kind of jumping off that last question, is there any consideration about activating the Ohio National Guard to help at Ohio hospitals? I know today there were some Indiana hospitals, for example, who requested that help from their National Guard dealing with similar situations and concerns.
Well, I can tell you that's always a consideration. However, we have to remember the nature of the Guard. The Guard is made up of Ohioans. And in the case of the kinds of Ohioans that we would be looking for to help with our hospitalization issue and the staffing of our hospitals, that largely means highly trained healthcare workers. And we could, by activating the Guard, one of the problems there would be taking valued healthcare workers from one part of Ohio and moving them to another. The challenge with this COVID-19 surge is, well, yes, it is more acute right now to the north. It's not like any part of Ohio is doing real well. The rates of COVID-19 in every county in Ohio are very high. Hospitals in every part of Ohio are being significantly impacted. So in this state, the idea of moving healthcare workers from one portion of the state to another, it isn't as appealing. Doesn't mean that it's not something that at some future point wouldn't be a good idea. It is something we watch and we monitor. Meanwhile, we've been working very closely with the hospitals and the Ohio Hospital Association to pursue a whole variety of strategies, some of which we've outlined, but some of which also look at ways that we might potentially be able to improve the overall staffing situation. That work is going on daily and will continue to go on as we go forward.
Thank you, Dr. Vanderhoff. Our next question is from Jim Province with The Blade.
Hi, Dr. Vanderhoff. I might have wanted to ask this question of Dr. Seaman, but you've talked about the correlation between illness and the unvaccinated. But I haven't heard an explanation as to what it is about the northern region of the state that has made it less receptive to vaccines. Why isn't the messaging working there?
Well, one of the things that we have been very consistent in terms of how we have approached this has been to appeal to the people of Ohio with good information, with good knowledge. We have had a focus on addressing concerns about the vaccine and hitting those concerns head on, winning people to what we believe to be the right medical decision. And I think earlier you heard a discussion among us as physicians about the challenge that we face with all kinds of medical decision-making and the importance of being persistent and consistent in our messaging about the importance of, in this case, getting a vaccine. You know, there are a whole variety of reasons that people may have hesitation about getting vaccines, and they range from fears about safety that we've attempted to address, belief that perhaps the virus is not going to impact them, which we've tried to address, as well as some other fears that relate to trust. and trust in medical authorities or trust in authorities generally. Again, which we've tried to address through an approach that has been one that is consistently around education and support. And I think that those factors are the ones that roll together to challenge the vaccination effort. But rest assured, we are going to continue to be persistent and consistent in our messaging to the people of Ohio about the vital importance of vaccination.
Thank you, Dr. Vanderhoff. Our next question is from Peyton Marshall with Fox 45 and ABC 22.
Thank you. Dr. Vanderhoff, with the discussion of boosters and also this new variant, do you think that the definition of what fully vaccinated is will change? And when do you think that will be? And in addition, if I can also ask, just because this is National Flu Vaccination Week, there's been discussion of future mRNA vaccines that would combine both the flu vaccines and COVID-19. Do you think that that's a possibility in our future?
Great questions. First, let me begin with the first. And I think that any changes to how we would define vaccination are always possible. But as we look at the data, particularly the emerging data regarding Omicron, to me right now, there's really nothing to suggest that primary vaccination will not continue to be defined in the way it is as getting 2 doses of your mRNA vaccine of choice. I think that the need for a booster is not uncommon with vaccines. And the real question is, what is the frequency of that booster and what is the form of that booster? Quite likely, our booster in form and perhaps even our primary series in form will evolve. And that's typical of vaccines. Many of the vaccines that we give today for a whole variety of illnesses have been enhanced and improved over time. And what we administer today is a slightly different formulation than what we administered when that vaccine first rolled on to the market. But I feel actually continued confidence in the vaccine platform that we currently have. It clearly is doing a good job. Now, you do point toward one of the great things about mRNA vaccines, and that is the ability to modify them, to produce them, and to potentially link them with other vaccines is significant. And I think they do point towards a future where the convenience of vaccination will likely be enhanced even further. But there's a lot of research to be done in that arena before we get there. Let me open it up to my physician colleagues just to see what I may have missed or what additional ideas you would want to share.
Yeah, so the CDC is clear. At this point in time, they are not changing the definition of fully vaccinated. To be transparent with people, we don't know what's going to happen in the future. A year from now, could that potentially change? Maybe, we don't know. But the CDC is clear that they are not changing the definition of fully vaccinated now. To piggyback with what Dr. Vanderhoff just mentioned, the simple answer to that is yes. With mRNA vaccines, they can, and they are studying having combined mRNA vaccines, perhaps with SARS coronavirus 2, the virus that causes COVID-19, and influenza, or perhaps even 2 different strains of the COVID virus. So that's what's really, really revolutionary with what we have now, what I think is going to be the renaissance of modern day vaccines for many other infections and also even other medical conditions. So yes, to answer your question, I do see that on the horizon. It is being studied by vaccine manufacturers today.
Thank you, Dr. Gestaldo. It is now noon exactly on the dot, so I believe that is the final question we had time for today. Dr. Vanderhoff, if you'd like to share any final remarks.
Well, again, I thank you all for your continued efforts to bring attention to this important issue, the issue of COVID-19 and its impact on our state. I want to thank my physician guests for taking time from their busy schedules. And again, remind everyone, particularly in the face of the Delta surge that is before us now. Please get vaccinated if you have not already, and get your booster if you're eligible.